Welcome to my podcast. Today I'm going to talk about another common case in the UK. Basically, after you introduce yourself, double check the patient name, date of birth. You'll ask the patient, "How can I help you today?" So the patient might say, "Doctor, I'm feeling low. I'm feeling not myself. I'm feeling stressed. I'm feeling lonely. I've been through a very bad situation. It could be separation, divorce, split up." Losing job, financial hardship, physical illness, mental illness, taking drugs, taking alcohol, personality disorder, so all sorts of things that could come up with. So I need to ask the patient, "Can you tell me more about it?" And then you will ask a certain question just to know about the whole situation. So, for instance, when it happened, when did you notice that? If any of your family member have noticed this, do you have any support network like family, spouse, friends, anyone in your family that you can relate to and talk to? How long you've been living alone? You assess the age as well, if it's elderly or young, because there is a certain group of age which is more vulnerable to this thing. Also, when did you lose the job? What happened? If it's a retired person, if there's any physical illness, if there's any, and you need to ask about any history of self-harm, or if the patient is planning to end his life or her life, or if they wrote a note about this, or if they have any plan. Also ask if there is any bereavement in the childhood, and if there's any family history with mental illness or affective disorder or alcohol intake or suicide. And you need to think about the social class as well. However, it's not immune in those kind of things, because basically depression, low mood, suicide, all of this can happen in any social class, and it has been stated also it happened mostly in the professional people like doctors. And you need to check what sort of personality trait the patient has, if it's impulsive, aggressive, liability of the mood, and also if there is any chronic illness or chronic pain. This can be debilitating, can affect and impact the patient daily life and daily chores. Also, what sort of education attainment they have. It's been stated that high education status or high premorbid functional status, which is basically the smartest people, they are more prone to this. Ask about if there is any depression history, suicidal ideation for the last few months, for instance, 5 to 6 months. So all of that you need to ask. And after asking all of this and asking about the medication history, any allergy, what sort of lifestyle do they do, whom they live with. It has been suggested in a report of 2018. It shows that people take their own life and they deem to be absent risk at their assessment. So obviously there isn't any even risk factor for those kind of people who took their own life all of a sudden. And also a Swedish-based study in 2017 shown that people who has obsessive compulsive disorder, they are more prone by 10 times than the general population to die by suicide. So it's another thing to put in mind, because people with the OCD, usually they have distorted thinking, feeling despair and hopelessness, and always they feel that they are not clean, they always need to clean the thing, they always exercise too much cleaning measure, and despite of that they still feel it's not so. So all of that you have to think about and always assess the condition and ask direct question. Don't feel offended by asking a direct question, and it won't cause anything, because you are direct and you try to understand. And as I say, no one is immune. Any class can happen, from 1 to 5, any sort of class, high, low, poverty, rich, anyone can have this situation, and they're a member of family. And even sometimes those risk factors not existing, so you wouldn't tell exactly who would go for that, and it's a total shocking thing for the family and the affected people for their lost beloved ones. And it's also common in the UK, especially in the professional group, which is mostly doctors, where they take their own life for various reasons. So just you have to know and try to understand what's basically the situation. Mostly it's in gender-wise, it's mostly in men who live alone and mostly elderly sometimes, or if affected by any sort of things that I just mentioned the points about. So always safety net the patient and give them the reach out for instance, like Sumatrine and the numbers in a leaflet whereby they can reach for help if they felt that they need to talk to someone or they were through a very difficult situation and they feel very desperate. Sometimes just the talk for its sake, it could help a life of any person. Thank you.